Hi, I'm Justin Riley. The month of November is National Diabetes Month and National COPD Awareness Month. Today in Wisconsin Doctors, we'll be on location at Upland Hills Health to learn more about both and also managing chronic conditions. My guests will include Dr. Joseph Berg, who is a family medicine practitioner at the Mount Horeb Clinic of Upland Hills Health, Jamie Jordan, registered dietitian, nutritionist, and diabetes program coordinator for Upland Hills Health, and Lauren Olinger, registered respiratory therapist. She's going to be talking to us a little bit about COPD. That's all coming up right here on Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and I'm joined now first by Dr. Joseph Berg, who works in family medicine at the brand new Mount Horeb Clinic. Dr. Berg, welcome back.
Thank you.
Good to have you with us again today.
Good to be here.
So we're talking a little bit about chronic conditions today and managing chronic conditions. You know, I've heard this term a lot. Can you talk to us a little bit about what is considered a chronic condition and how do we manage them?
So chronic conditions is kind of a really broad term
Right.
in medicine, and it's kind of sometimes hard for us to define, but I think what you're asking about are common medical conditions seen very commonly around the country that are controllable or can be improved but can never be cured. Specific examples would include diabetes, high blood pressure or hypertension, cardiovascular disease, or obesity.
So those are all things that you'll probably be living with for probably the rest of your life, but they can be managed.
Exactly.
Yes.
That is exactly right.
Yeah.
So Dr. Berg, how many people do you think are affected, or how many people are affected by a chronic condition?
A lot. It is half of all Americans have at least one chronic condition, and 1 in 4 Americans have 2 or more. So it's prevalent in the United States.
So what typically causes most of these conditions to develop? Is it something external? Is it a genetic type of thing?
Right, so it's a mix of both. There are kind of 2 things that determine when you get a chronic condition. It's your genetic predisposition and environmental factors. So think of your genetic predisposition as like a range. So if you have lots of people in your family that have a specific condition, like high blood pressure or diabetes, then you're more likely to get that. Also, your environmental factors are things that can sometimes be controlled, but a lot of times can't be controlled, like smoking.
Right. If you grow up in a house with smokers.
Yes. Lack of exercise, poor diet, pollution in the air, those things. So environmental factors plus your genetic predisposition determines if you're probably going to get a condition.
So we're talking a lot about chronic conditions, and later we'll talk about diabetes later on in the program. But why are we talking about this today? What is there a theme? What's the theme? And why should we be concerned?
So I think there's 3 main things we can be concerned about. 1, chronic conditions lead to worse chronic conditions and disability. Like, for example, if you have diabetes, it can lead to blindness, amputation of your limbs, and kidney failure. If you have high blood pressure, it can lead to heart failure, stroke, again, kidney failure. And if you have arthritis, it can also lead to disability in the home. You can't do the things around the house. The other thing is it leads to death. About 70% of all deaths in the United States are caused in some way by a chronic condition. And lastly, they're expensive. So 86% of our healthcare dollar is spent on chronic conditions, managing them and their complications.
Wow, 86%.
And that's all great information. So what can we do to kind of help prevent these chronic conditions?
A couple things. Unfortunately, we can't improve our genetics. So
yet.
we can't do anything about that yet. But What you can do is know your family history and let your doctor know about it so they can know. The other thing is you can control what we call modifiable risk factors. Those things we kind of talked about, those environmental factors we can improve. Most importantly, you should probably exercise.
Right.
Exercise, if it was a pill, it would be the most popular pill ever prescribed. It is widely studied and it's shown so many benefits throughout all disease states. So exercise. If you smoke, quit and don't ever smoke. Very, very important, don't ever smoke. Also, have a healthy diet, which Jamie will talk about a little bit more later.
Yeah.
And everything in moderation. So, especially alcohol. If you drink alcohol, don't do it to excess, and try to limit it to 1 if you're a woman and 2 if you're an adult today, or a man a day.
There you go. Well, Dr. Berg, thank you so much for the information today.
Yeah.
We got to take a short break, but when we come back, we'll be talking with Jamie Jordan, who is our registered dietitian nutritionist, and we'll talk a little bit about diabetes management. Don't go away. There's more Wisconsin Doctors coming right up. Hey folks, welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and next we'll be talking with Jamie Jordan, registered dietitian nutritionist and diabetes program coordinator. Jamie, welcome back.
Thanks for having me.
Yeah,
it's good to be back.
Yeah, it's good to have you with us again. So I understand that November is Diabetes Awareness Month. Tell us why that's important.
Well, it's important because of how prevalent diabetes is. So it's something that's celebrated every November to bring awareness and to diabetes. So there's about 29 million Americans that have diabetes and about 86 million Americans that are pre-diabetic and either know it or don't know it. A lot of them don't know it. So it's to bring awareness.
So is that 86 million, I'm assuming that's somewhat of an estimate because there are some people who aren't even aware that they are pre-diabetic.
Exactly, yep.
Yeah.
What's the difference between diabetes and pre-diabetes?
Well, diabetes is basically a condition where somebody has high blood sugar. So their insulin or their pancreas isn't making enough insulin, or their body's not using it as well as it should be. So what happens is we have a lot of extra sugar that's just sitting around in our bloodstream. So pre-diabetes is basically when it's not high enough to be diagnosed as diabetes, but there's a chance that they might get diagnosed down the road.
They're close.
Yeah. And there's 3 main types of diabetes. So type 1 diabetes is where their pancreas doesn't make any insulin, so those are the individuals that have to give them shots or they're on an insulin pump. And then there's type 2 diabetes, which we kind of just talked about. But then there's also gestational diabetes too, which is in pregnancy, because insulin needs kind of go up really high during pregnancy. So those are the 3 main types of diabetes.
And what are some of the complications that may happen if somebody who has diabetes or pre-diabetes is not managing that properly?
Well, Dr. Berg actually touched on a bunch of those earlier, but eyes, it can affect your eyes, can cause blindness, it can affect your heart, your kidneys, your feet, the nerve endings it can damage in your hands and feet, and then even lead to like cuts or sores that won't heal, so skin issues, lots of things like that. So we always say it's important for people with diabetes to know their ABCs. So A is their A1C, that's the measure of their average glucose for about 3 months. B is their blood pressure, so this should be about 140/90 or less. And then C is their cholesterol, so they should know all those things to kind of help decrease some of those risks of complications. So.
And some of those things are things that they can check on a regular basis.
Yeah,
it sounds like.
Or go to their doctor and
Go to
have
the
it
doctor
checked.
too. Yep, absolutely.
What are some of the tips that if I sent someone to a dietitian, they would tell them on how food can either help or hinder their diabetes?
Well, I hear a lot of myths when it comes to diabetes and food, and one of those is that because you have diabetes, you can't eat any foods that have carbohydrates or sugar in it, which is actually not the case. Our bodies use carbohydrates as our main fuel source. So if you're not eating carbohydrates, your liver actually can make sugar. So we want to make sure we eat the right carbohydrates. So whole grains, fruits and vegetables. And then it also matters to kind of when you eat, how much you eat. And then, just kind of planning to have regular meals and snacks really makes a difference too.
Sure. There's nothing has to be too extreme. It just has to be balanced. I mean, we always talk about a balanced diet, but it really comes down to that, I think, is just making sure that you're living a balanced life with balanced food. So.
And Dr. Berg mentioned moderation. That's huge. So,
absolutely. We just have a couple seconds left, but can you talk to us about some of the programs that are offered here at Upland Hills Health that are related to diabetes management, and specifically when it comes to diet and nutrition?
Sure. We offer individual and group classes. Okay. So individual for medical nutrition therapy, it's called, and diabetes self-management education or training. So medical nutrition therapy is going to focus just on nutrition. We're going to create an individualized meal plan. Diabetes self-management training, we're going to talk about checking your blood sugar, being active, healthy eating, lots of different topics. So we offer those group classes about every other month. So.
Jamie Jordan, thank you so much for the information today. If you think that you might be in the stages of pre-diabetes, you should go see your doctor right away if you are identifying with any of the symptoms that were talked about here today. So when we come back, we're going to be talking more about chronic conditions right here on Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville. And with me now is Lauren Olinger, who is a registered respiratory therapist. Welcome.
Thank you very much for having me.
Yeah, well, thanks for having us here. And we're going to be talking a little bit about COPD, which stands for Chronic Obstructive Pulmonary Disease.
It does.
And some other breathing disorders. But first, can you give us a little bit of a background of, where you went to school and what's your role here at Upland Hills?
Sure. So I have been a registered respiratory therapist for 8 years at St. Mary's Hospital in Madison, and I fill in on an as-needed basis here at Upland Hills. Been in Madison for about 15 years, where I've got 2 degrees right in this field.
Very cool, very cool. So now, National Heart, Lung, and Blood Institute is promoting November as National COPD Awareness Month. So there's a lot of awareness campaigns going on in November. What is COPD?
Sure. So chronic obstructive pulmonary disease is a large umbrella term for emphysema, asthma, and chronic bronchitis.
Oh, okay.
And it's a disorder that affects all of your airways, filling it with mucus, making breathing tight, feeling that shortness of breath, and feeling that sense of wheezing or air hunger.
Okay. And why is this important? Why are we sharing this with our viewers today? Why is that important?
Well, it's very important. About 1/3 of all deaths in America are related to COPD, and about 12 million Americans have been diagnosed with COPD. Another 12 million have symptoms, no formal diagnosis yet. So we're talking about it to really get the outreach there to get people with the proper treatment.
Okay. And is there a difference between COPD and emphysema?
There is. Emphysema is a direct result of chronic smoking.
Okay.
And COPD is the large umbrella term used for all breathing disorders.
So emphysema is not something that you get just because you get it. It's something is directly
You've caused
related.
it.
Yes.
Yeah,
Okay.
unfortunately.
Yeah. And telltale signs of COPD. What are some symptoms? What should people be looking out for?
Sure. So symptoms of COPD would be that chronic cough, that feeling of mucus stuck down deep in the lungs that you can't quite cough out, that air hunger, you can't catch your breath, can't take a deep breath.
Can't get a deep enough breath.
Right. And feeling short of breath with just your daily activities.
And these sound similar to just being out of breath because someone might be out of shape. So how do they know, how does somebody know the difference, whether they're out of shape or if they have something more serious like COPD?
So if you are feeling like you are all have any of these symptoms, start keeping a logbook and record when you're feeling these symptoms, what maybe you're exposed to when you felt your symptoms, and discussing them with your doctor to distinguish the two be helpful.
Yeah, absolutely. And you guys offer some services here at the Heart, Lung, and Sleep Center of Upland Hills. I'm wondering if you can talk to us a little bit about how you can offer therapeutic services and so forth for people who do have COPD.
Sure. So those that have COPD, we can really help with a management plan with proper inhaler techniques, nebulizers for your medications, and the pulmonary rehabilitation program here to help you with daily activities, keeping your nice active lifestyle for every day and learning how to have coping mechanisms with your disorder.
Sure. And you said pulmonary rehabilitation services. Is that?
Yes.
And what can you elaborate a little bit on that? It sounds
Sure.
interesting.
It's a great program here in the Heart, Lung, and Sleep Center, and you'll get a personalized exercise routine,
Okay.
a nice dietitian and nutritional services, and you'll learn all of your coping mechanisms along with education on your disease and medications.
Coping mechanisms, important to be able to deal with the disease, but
Yes.
also important to know how you can retrain your thinking and retrain your
Yes.
lifestyle,
Yes.
reset your lifestyle to be able to properly cope with it. So
Yes.
we got to take a short break, but when we come back, we're going to be talking more with Lauren Olinger, Lauren Olinger, excuse me, registered respiratory therapist here at Upland Hills Health. Don't go away. There's more Wisconsin Doctors coming up right after this. And welcome back to Wisconsin Doctors. We're filming here on location at Upland Hills Health in Dodgeville. And we've been talking with Lauren Olinger about, well, she's a registered respiratory therapist, and we've been talking with her about COPD. And I want to ask, how does a person get COPD? What causes it?
Sure. So many of the environmental factors and personal lifestyle factors can lead to COPD. So those with smoking history or secondhand smoking history, and environmental factors such as constant breathing of air pollutants, and also a rare genetic disorder called alpha-1 antitrypsin, very rare. Unlikely you have that. So the other two being your smoking and environmental main causes for COPD.
Sure, and we talked in the previous segment about how emphysema really is caused exclusively by
smoking.
Yeah, and so that's a form of COPD, emphysema.
It is.
So my question is, do you typically see certain types of people from certain industries coming in who have COPD? What types of people are you seeing, and what are their professions usually?
Sure. So right in our area here would be farmers. So those that may have heard the term farmer's lung, any type of farming industry where you're breathing in pesticides or silage, dust particles in an everyday work lifestyle really do damage the lung and cause that permanent damage and scarring.
And we were actually talking with our producer just a few seconds ago before we shot this segment, and she had mentioned that her father did not have any sort of protection when he was farming, and so now things have come so far. And things have gotten so much better. Farmers are in cabs now when they're in there on their tractors and so forth, and there's ways of protecting themselves. But it's still something that needs to be really, really looked at, and people need to be vigilant about.
Yes. Yeah. It's an unnatural thing to be breathing it all in, so it's harmful.
Yeah. Is the lung damage permanent? I mean, can it be reversed?
So there is no cure for the lung damage that's been done, but you can really manage all of your symptoms and with a proper treatment plan, live a very good everyday life. But no, it is not curable.
Not curable.
Not curable.
Can there be any improvement at all? I mean, have you witnessed improvement after treatment?
Yes. Your lung function can improve. You can regain your mobility that you had once before with proper treatment and proper technique, and that nice personal relationship with your physician will really help you.
Do you have any examples? Can you give any examples of patients who weren't able to do certain things before they got treatment and now are able to do more things?
Yes, so within the pulmonary rehab program, you'll get a personalized exercise routine with Becky or Lance. And we've had really great success stories on those that have been short of breath even while grocery shopping, and now they are out there doing chores with their kids. They are playing with grandkids. They are doing 5Ks.
Wow.
So we've got some really good success stories. Yeah.
That's pretty cool.
Yeah.
That's pretty cool. Why do you think people hesitate to talk about their symptoms when it comes to possibly having COPD?
Well, the symptoms may feel and get masked by just thinking you have a common cold. And that you think that common cold may go away. Or that chronic cough is just a cough, it'll go away. When really it's those pre-risk factors that are starting to show.
And I think, I'm guessing a lot of people may think they have a common cold and they might have it for a couple of months and keep thinking to themselves, this is going to go away,
It'll go away.
pass, this will go away, and it never does, and it maybe even gets worse.
Yeah,
So-
or seasonal, it'll go away when the allergies are done.
Right, yeah, and when the allergies are done. So, Lauren Olinger, thank you so much for the information today. Thanks for talking with us. Really important topic, really important for you to go and see your doctor if you think that you might have some of these symptoms that we talked about today. Thank you so much.
Thank you.
That's all the time we have for Wisconsin Doctors. We've been here on location at Upland Hills Health talking about some chronic conditions. From all of us here at CW57 and Wisconsin Doctors, we invite you to live longer, live better. We'll see you next time.